My name is Darlene Magdalinski, and my population is older adults in healthcare settings. In particular setting is nursing home, and I will be focusing on comorbidity conditions. What is multi-morbidity and comorbidity? Comorbidity is two or more disorders or illnesses that happen in the same individual. They can happen either at the same time or after each other. And they can consist of, for example, depression, anxiety, psychosis, dementia, substance use disorder, diabetes, cancer, plus much more. Also, comorbidity can interact between two or more of the illnesses, which could make them worse. Multimorbidity is used interchangeably as well with comorbidity. It focuses not on the management of disease, but in fact the complexity of managing disease in residents. We have two or more medical or psychiatric conditions. And when I say psychiatric conditions, it can be, like as an example, depression, anxiety, or medical, it can be diabetes or cancer. How is working with this specialty population different from others? Well, working with the older adults in a healthcare setting, including nursing home, experience higher rates of chronic disease. In 2012, older adults suffered with two or more chronic conditions, and some additional examples of chronic conditions are heart disease, stroke, and like I mentioned, diabetes, chronic bronchitis, dementia, just to name a few. This population, 65 and older, is expected to increase 23.5% in 2060 from 2014 at 14.5%. Identify and discuss two main challenges, needs specific to this specialty population. Some main challenges or needs specific to the older adult population is nursing home setting that I have recognized are many. There are managed care, advocacy that includes physical and in-home psychiatric care, also resource promotion, health promotion, and disease prevention. The two that stand out to me is advocacy and disease prevention. It's critical in this setting. I say this because it increases access to psychiatric help, lower hospital admissions, and the patient will save money in the long run. Some additional challenges and needs that I have also recognized on top of this are communication, support, distress, life changes, independence, placement, loss of privacy, anxiety, fear, and family connection. How would you as a social worker working with this group prepare to address such challenges or needs? As a social worker working with the elderly population in a nursing home setting, I could address challenges and needs in several ways. I would provide emotional support and monitor the quality of services provided to the resident and the family members. Also, I will implement suitable interventions from a group, individual, and family perspective that will improve psychosocial functions. I will incorporate social integration through planned activities, help with direct services that include family members at times of admission until discharge. How would you as a social worker working with this group prepare to address such challenge needs? As a social worker, I will make sure that I also incorporate all necessary steps in residents' treatment plan from a multi-perspective view. This is suggested as a preventative measure linked to fragmentation of the older adults' health care. The article I read included 7 core components consisting of multi-perspective view of health and social care management for older adults with multi-morbidity issues. The 7 components consisted of cooperation, availability, continuity, support, competence, political steering, and leadership. I wanted to add that I think this information is important because in the nursing home setting, treatment plans are part of what social workers conduct with residents who suffer with multi-morbidity and comorbidity conditions. What resources I would need as a social worker. Some resources that I would need as a social worker are as follows: Administration on Aging, AARP, American Geriatric Society, Center for Disease Control and Prevention, Meals on Wheels, Transportation, Social Security Administration, Life Veterans Administration, Medicare Rights Center, and Family Care Caregiver Lines. These are just some of the people that I deal with. You have people that also deal with equipment. You have different home health services. So there's various of different resources that we as medical social workers that we could use to be able to help the residents. What resources will the clients and patients need? I believe that the social worker and the resident will need the same resources in order to effectively help each other and the loved ones, help them and the loved ones in short-term and long-term stage. I believe there should be a collaborative relationship not only with the team of people that we work with daily, but also outside agencies so that we are meeting the needs of the residents and families. With my experience working in a nursing home setting, they need us and we need them. We all need each other. For example, resources, residents, and social workers. An inclusive and cohesive team is the key. Why I believe I am a different and effective medical social worker and demonstrate genuine and unique skills. As the sign says, all of this incorporates help, service, assistance, support, guidance, and advice. How would you as a social worker distinguish yourself from others working with this client population and highlight your various skills aside from basic case management, discharge planning roles? I think the primary way I distinguish myself from others working with the older adult population is that I am passionate and well educated. You can tell the difference between someone who cares and someone who is showing up for the paycheck. The difference with me is I do it for free. Not many social workers can say this. I am very open-minded, understanding, empathetic, friendly, sociable, caring, loving, and a good listener. I do not hear the residents and their family concerns. I listen to them. This is a big difference. I address and resolve the issues. Concluding comorbidity conditions, nursing home setting. The Affordable Care Act of 2010 has provisions that included particular preventative services to Medicare that includes cancer screening, especially in racial ethnic groups, who does not take advantage of these services. It is said that professionals, paraprofessionals, paid and unpaid caregivers should have basic and continuing education. Also, physical activity can help avoid disease and injuries in older adults. There are evidence-based federal efforts to enhance chronic illness such as comorbidity in adults and older adults. The chronic disease self-management education is just one of them. Also, the Older Americans Act programs have various fundings for services and supports for low-income older adults. This program will help patients continue their health and autonomy. This is the end of my PowerPoint, and I say to all of my classmates, you as medical social workers, the nursing homes need you. Here's my references. I want to thank you guys for listening to me, and I look forward to reading your PowerPoints. Have a great day.